What's up, Naki?
What's up, Carl?
It's Koviki Talk time. It's been a minute.
Been a minute.
It's exciting to be back on Koviki Talk. We're Not Oppo. It's brought to you by Not Oppo, the National Association of Pacifica Organizations. It's
That's right.
our national level PI organization. Koviki Talk is a show about COVID-19, but we talk about it from the Pacific Islander perspective. So we have amazing people like our guests today on to talk about whatever the right timing is. And right now, there's some great things going on in the state of Utah. So we want to get plugged in with those people there. So we're going to introduce our guests. And then we also have Dr. Samoa on because we have a new variant and there's all kinds of questions out there. So we wanted to get Dr. Samoa's opinion on that. So our first guest is from Utah, Dr. Kawehi. Born in Honolulu, is of Hawaiian, Maori, Chinese, and Portuguese descent, raised primarily in Layton, Utah. Graduated from BYU, Hawaii in 2003 with a BS in mathematics and a minor in biochemistry, and from the University of Utah School of Medicine with an MD in 2008. Completed residency in internal medicine and pediatrics in 2012 at Loma Linda University in Loma Linda, California. Practiced as a pediatric hospitalist for Intermountain Healthcare for 8 years, and now is an outpatient clinic caring for adults and children at BYU in Provo, Utah. Kawehi mentors several medical students and pre-med students, currently as an advisor for the Pacific Island Medical Student Association at the University of Utah and as a mentor at BYU. Welcome, Dr. Au.
Thank you for having me.
Yay. We off camera, we have audio. We have Otsolose Fahina, Tavake-Pasi, who is on, but you can hear her. We can hear her. MS has been the executive director of the National Tongan American Societies. Let me do that again. National Tongan American Society since 2003. Her leadership skills have helped to develop programs that provided access to thousands of Pacific Islanders in Utah to healthier lifestyles, increase civic engagement, achieve citizenship, access to higher education, obtain social justice, and promote cultural preservation. Fahina's earned degrees include AA in aeronautics, okay, girl, BA in sociology, MS in health promotion and education. She has also received dozens of leadership and achievement awards. She has served on dozens of national, state, regional, local, and also international board of directors as advisory committees. She was born in Tonga, grew up in San Mateo, California, and now resides in Salt Lake City, Utah with her family. Welcome, Fahina.
And Fahina is, it's a Pacific Islander show. So there's all kinds of different things we juggle as Pacific Islanders. And one is being the Uber driver for her. Is it her grandkids?
Her grandkids. Yes. And then, of course, we have the ever so famous, everybody's go-to Dr. Reynold Samoa, MD, is a clinical research endocrinologist. He has a lifelong fascination with obesity-related disorders and has parlayed that interest into research project investigating the metabolic conditions that affect populations vulnerable to diabetes, such as Pacific Islanders and cancer survivors. Dr. Reynold Samoa received his medical degree from the University of Washington. He did his adult endocrinology fellowship at the Los Angeles County University of Southern California and his pediatric endocrinology fellowship at Children's Hospital, Los Angeles. Currently, he is an assistant clinical professor at the City of Hope Medical Center in Duarte, California. Dr. Samoa is also the lead for the Healing Association of Pacific Islanders Happy Doctors, which is an organization under the National Association of Pacific Organization, Not Oppo. Welcome, Dr. Samoa.
Thank you for having me.
Yay.
It's been so long since we've had a show. I didn't want to ask. Do we have an icebreaker, Naki?
Well, no, I thought we would just go straight to all the information and learn all the wonderful, amazing things about Dr. Au, Fahina, and Dr. Samoa.
Yeah, it's important for us to learn learn from places that are doing well. So Utah's definitely one of those where the Pacific Islander community is healthy.
Yes.
And by healthy, I mean representation and being a big piece of the community. So talking to Utah and seeing what's going on there is the goal of the show. So I think that you want to turn it over to who you want to go to first?
Dr. Al, let's go to you, Dr. Al. Can you tell us a little bit about yourself and the work that you're doing there in Utah?
Yeah, so I was a hospitalist. I enjoyed being in the hospital mostly just because that's where my training was focused. And so in the hospital, we take care of people who are sick and cannot otherwise go home until, something that they have resolves. So I switched over to being an outpatient doc like right before COVID happened. And so was worried that, a lot of clinics had to shut down or at least decrease staff, especially like surgery clinics, because, things were not urgent at the time. So I was kind of worried if I was going to have a job or not, but little did I know that going to BYU, we'd be doing COVID testing, a lot of COVID testing to keep the school open and to help keep the community healthy, because we found that college students like to gather together and have a little bit of a hard time outside of school, staying safe, at least at the beginning. And so they felt that the college students were causing some of the spikes of COVID in the community. So we were part of at the BYU Health Center, we're part of most of the testing and education, placing people in isolation, and that's continued throughout the whole last year and a half, almost 2 years now. So yeah, that's what we do. And the Utah Pacific Islander Health Coalition that Fahina is a part of, they all meet quite frequently and have recently started an initiative to have Pacific Islander healthcare workers and others who are interested, like especially the community health workers, who are going to start making vaccinations available at home. Like they'll be going to the homes of Pacific Islanders who need their vaccinations and provide them there. So that's, go ahead.
No, I'm sorry. I didn't mean to cut you off, but the younger college kids, are you finding that the numbers now, like in the beginning, are you saying that in the beginning it was hard to control the numbers within the young adults? And my question is, do you find that we have less of a problem trying to control the kids because of everything that's happened from beginning to now? Or is it still the same? Are the youngsters still, buck wild?
Well, we have a high vaccination rate now at BYU. And also they decided, based upon surveying the staff and the students, we had to report our vaccination status. They're not mandating vaccines, but they want to report. And our statisticians ran the numbers and decided that we needed to return to school with masks on. So I feel like that's helped a lot.
So it's not mandated there in Utah?
No, vaccines are not mandated.
Oh, wow.
They're available to everyone, though.
How do you think how did you get such a high rate of vaccination at the college? I know there's been a lot of efforts that haven't been successful in getting high vaccination rates, and it seems like the right things were done and you were able to get back to, somewhat of a normal learning environment. How did that happen? How did you get such a high success rate?
Oh, so sorry. It looks like my my laptop is gonna die here pretty soon. So, shoot, my charger. It had my charge was pretty high. So sorry. Let me just turn the camera off.
That's okay. I was on the search for power just before the show. I was in the same. Where can I plug in and where can I get the power from? I'm actually using a laptop that's not mine right now, so I feel you on that one.
Okay, so I think if you look at the survey data that Dr. Samoa sent out, I'm not exactly sure who even provided that survey data, but who got the surveys or where they were done or how they were done. But you can see that education and income level had something to do with people's lack of hesitancy. And so I think being at a college, that helped. And also we did a lot of education with the students and with our patients as well, and that effort to get everyone vaccinated. And of course, everyone wanted to be able to be in person, because there was always the threat of possibly being on Zoom again for another year. And that really hurt the mental health of a lot of people. And so I think that was a good motivator. for students and for staff to get their vaccines.
I think that's a good point, the stick or the carrot, right? So, and we talked about that, early on. There was a lot of like, is it fear driven or, and how else can it be? And it could be, effective that we all want to get back to at least close to the normal life that we had in 2019 before it all showed up. So it's kind of the carrot, right? So if we do this, then we can get back to, in-person learning and those kind of things. Were you surprised at the positive response from the student body?
No, because I saw so many in tears that they got put in isolation yet again. I had a student tell me, I've been in isolation 3 times, because you can't like wear a mask 24/7. So if you have to share a room with somebody, your roommate gets sick, you get sick. Same thing happens within families. So yeah, people really struggle, and I deal with a lot of mental health all day at clinic. So it's been hard for people, and they just want to get back to normal. So I think that really helped. Like we received permission from the Department of Health to. Oh, hi.
Hi, baby.
That's part of the show.
Hi.
Okay.
I'm sorry, I didn't watch TV.
Yeah, I'm not watching TV. I told you.
Oh, so polite.
Sorry, yeah, it's my little girl.
That's what
beautiful.
And that's part of it being a Pacific Islander show, right? We have probably a higher percentage of kids popping their heads in and saying hi than a lot of other shows, and we love that part. So in that in the effort to keep everybody safe, it has damaged and had a significant impact on the mental health of everyone, but maybe more so with Pacific Islanders because we're so social and we look for we look for reasons to gather and celebrate and share our love with one another. Can you talk a little bit about what you've seen from an impact from a mental health standpoint with the Pacific Islanders in Utah?
So I don't have a whole lot of Pacific Islander patients at the university, but I was just on a panel with Liana Kinney. She's a doctor of nurse practitioner here in Utah, and she said it's been really difficult for people, and they've had a hard time combating a lot of the impact of places where people are getting their information about vaccines. And so, it's been really rough on the Pacific Islander community. She said that she had a Tongan patient who needed to be admitted, and his family told him like his oxygen level was like down to the 70s. And his family was telling him like, don't go to the hospital because you won't come home. And so the residents that we were speaking to at the University of Utah were asking like, how can we help the Pacific Islander community? And so we mentioned that it's important, like some of the hospitals, you can only have like a limited number of people that can be in the room.
Right.
And that it would be really helpful if, we could safely allow more people to be in the room to support their loved one, because that's a big deal. And she said that with the communication between the staff and this Pacific Islander man that needed to be admitted, it helped the whole situation to turn around for them to understand that he needed to have, family members with him at all times. And so I think just being sensitive culturally to, members of cultures that are not ours
right.
is important, because this person's mental health was being affected by not being able to have family members with him, and then, not being able to gather as much as possible. I do feel like Pacific Islanders are still gathering. I mean, we have Facebook. So
yeah.
I don't really feel like I've ever seen a time when Pacific Islanders weren't gathering. I do have like personal friends and family members that have so I have a Tahitian family down the street, and they have a multi-generational home just like I do. My dad lives with me. He has diabetes. He's obese. He has high cholesterol. Like he's just, he's 70. So he's got like every risk factor known to man. So, we've been really careful. And, when we're around other people, we wear masks, try to avoid being around people as much as possible because of the health of our loved ones here. And so are the Tahitians down the street. So it's kind of nice to kind of like kind of cocooning, like with like, you know, families who have like similar practices and beliefs in taking care of our elders, and but still being able to like be with each other. So and we try to be outside as much as possible, but going into winter makes it difficult again. So
Yeah, I think that's a big help. I mean, not only because of multi-generational homes, if we work outside the home, we have to really be careful of bringing something home to our parents, our grandparents, but also at the same time, we're all together, right? Because there's a lot of people that are not of PI, non-PI. Their parents may live somewhere else alone. I think it's a lot of Pacific Islanders have their parents and their grandparents in the home. So, and that mental health is so important for. I really believe, like in the hospitals, we usually have somebody sleeps over and goes gets the water, or go gets the nurse when they need something. Where in the hospital, I believe sometimes that when you're alone, you don't want to bother the doctor or the nurse, right? I think we don't want to be a bother. So, but we'll get our daughter or our granddaughter, hey, go get me water, go get the doctor, go get this, go get this. So I think that's a big part of our mental health and getting well.
I also
Especially
think like trust in the medical community.
Mhm.
My grandma came and visited from Hawaii to watch one of my cousins graduate, and she ended up in, she has diabetes, and she had, both of her legs were amputated from the knees down, and she had, she was on dialysis, and she ended up in septic shock in the ICU. And we made sure there was always one of us there. And I did observe some things happen that needed help. Like,
Yeah.
there are some things,
Legal
so I think there's
assistance.
also like, and medical errors happen. We know that it's an issue. Like we try to minimize it by,
Right.
safety checks, and like, there's always like quality improvement going on in hospitals. But I think it's always, as a Pacific Islander myself and someone who's in the medical community, and also my brother is an orthopedic surgeon, like we kind of know that it's always good to have someone there just to ask questions, to interpret for, what's actually happening, and to convey your loved one's wishes. Like my grandma, she's like, I don't want to die here. I want to go home.
Right.
And they're like, well, you're not ready. And so I would always just encourage them, like, hey, her blood pressure has been great for like an hour. Can we turn down that medication so we can get her closer to going home? Because she does not want to die here. And I want to honor that for her. She wants to go home. So, just those types of things, advocating for our family members and making sure they're safe and heard and
Right.
stuff like
that. Do you know if the numbers are going up or down? Because a lot of people, the vaccine rate is high there. Do you know?
The last
Or
I checked, the numbers have been pretty
level?
stable, yeah, for a while.
There's a good
Leeway.
statistic to put out there is
Yeah.
the vaccination rates are high.
Yeah.
And it's not increasing. It's staying level. You had talked about with the mental health, and maybe because I spend a lot of time seeing Dr. Samoa and the things that he's involved with, being a source. So not as just being a doctor, but being a Pacific Islander doctor. Sometimes the family and friends and community members are going to come to you even more so because you're a PI and you're a doctor. Do you find yourself balancing, keeping that work-life balance, or do you get a lot of questions from Pacific Islanders and family members about the pandemic?
I do get a lot of questions, but I appreciate that. That's why I went into this. I wanted to be able to help my community. So I am grateful when they ask me, and I'm grateful for the education that I have, that my parents sacrificed for me to get it. So yeah, I appreciate that when they do ask me questions. Sorry.
You had did you mention your brother earlier? Had you mentioned your brother, and what does he do? Because that was something that struck me when you had said that.
He's an orthopedic trauma surgeon in Dallas.
So education is obviously very important in your family. Can you talk a little bit about that? Your journey through education. A lot of the people that we talk to, Pacific Islanders, they kind of talk about not necessarily a loneliness, but the further they go in education, the less and less people they see that look like them in their classes. Talk a little bit about the commitment that your family's made to education and your own journey through the educational process.
Yeah, sure. So 3 out of my 4 grandparents are teachers. Both of my dad's parents went to school like later in life, like after they had raised their family. So my dad's the oldest of 8.
Oh,
He's
wow.
from Laie, Hawaii, and his mom taught at Kahuku Elementary, and his dad taught at Laie Elementary. But they had gone to school later in life, and encouraged him to get an education. So after we actually moved here to Utah so that my dad could get his master's degree. So he got his master's degree, and then later on, after I was finished with high school, my mom went back and got her master's degree as well. She became a teacher. And I have several cousins, aunties. I don't think my other brother is a teacher. So it's always been a big deal in our family just to like learn as much as you can and help your community as much as you can. So when I was little, my grandma's second husband had ALS, also known as Lou Gehrig's disease.
Mm-hmm.
And I helped take care of him. And I was like 5, I think. And I told my dad, I'm like, hey, when I grow up, I want to be a nurse. And my dad said, hey, why don't you be a doctor? And I was like, okay. So I always saw myself doing that because my dad kind of instilled that in me. And I always enjoyed science. I enjoyed helping people. So it was kind of natural for me to do that. But I did notice that, like, as the further I went in education, it felt like what you said, it felt lonely.
Yeah.
So I started out at BYU in Provo, but I didn't feel comfortable there. It was just such a big place. And so I went to BYU Hawaii, and there are like other Pacific Islanders that were studying to become doctors. And so it was more of a supportive environment for me rather than like this competitive, like, I felt like it was more like, did I do better than you? Or instead of like, let's help each other. And that's how I felt at BYU in Hawaii. And so plus I had my family there, and it just felt like home. So I just kind of continued in my journey. And when I was at University of Utah School of Medicine, there were a lot of opportunities to go to the community in elementary schools where they were primarily people of color. And so we knew how important it was to be visible. So there was a Tahitian in my class, and there were several of Mexican descent and Asian descent. And we would always volunteer for those programs and go, and the kids would be like, oh, like, you're going to be a doctor? Like, yeah, just like you can be one too if you want to. And so I think it's important. That's why I love working with the pre-medical students and the medical students. So there are several Pacific Islanders at University of Utah right now that are in medical school, and they are doing great things. So
awesome. They'll become happy doctors right after too. I see the light bulb go off on Dr. Samoa's head. Did you say doctors? Dr. Samoa, what about the data can you tell us with that what's going on in Utah?
Can I share screen? Let me see.
You had said about Kahuku. You mentioned that Kahuku Laie, that whole North Shore piece, and it just reminded me that I've never seen as much pride in high school as Kahuku. I can be in Texas, I've been in Louisiana, and I've seen Kahuku Red Raider stickers all over trucks, cars. I've seen Red Raiders jerseys and shirts all over the United States, and it's amazing to see just the pride that comes from Kahuku. There's Red Raider stuff everywhere. Are you a football fan? Did you pay attention to the big game in September where BYU they didn't smash the Utes, but they definitely won the football.
They definitely did. Yeah, I am. So my little brother played at the University of Utah. So I am 3 out of the 4 of us went to the University of Utah. So we are definitely University of Utah fans, but we also support any Pacific Islanders wherever they play, and especially Kalani as a coach, definitely support him as well. Like anything great that a Pacific Islander can do is we're a fan of in this family. So yeah.
Yeah, that is a rivalry.
It is. It's really fun. Like we've won 9 out of the last 10 games.
She knows the numbers.
By the way, just by the way.
I'm like, after the COVID numbers, I'm not quite sure, but I know those ones.
All right.
Can you guys see the slides?
Yeah,
yes,
we can.
it's up. It's up.
This was a national survey, and one of the community founding organizations for Naopo led the survey in the region, and so Fahina was the one that kind of shepherded the survey in Utah. Hence why the predominance of respondents were Tongan. And they had a little bit more than about 100.
Nice.
100 responses. And as you can see that about 54% were hesitant, kind of echoing kind of what Kawehi was talking about. And, the big community push that's kind of helping improve those numbers was no small feat, which I'm sure Fahina can speak to very well. The predominance of our respondents were female. I don't know why. That was just the women are smarter. And so almost in all the regions, it was a predominantly female cohort. And so the education level attainment, as you can see that there was a slightly more hesitancy. So the red bars are the hesitant, and the orange bars are the respondents that were more likely to get the vaccine. And you can see, their numbers are pretty dismal when you get up into the upper educational attainment levels, but that, it swings to being more receptive to the vaccine the higher your education level. And then when you go to the other end of the continuum, you see people are a little more hesitant. Now that's something we see across the board in most of the states.
Right.
And then same thing with income level. There's a little bit of a preponderance towards getting the vaccine when you're up in the higher income areas. And then you get more hesitant as your income level is lower. Not much of there's a lot more hesitancy with the non-essential workers, which is a little bit, we haven't really seen that big of a difference between hesitancy with essential workers in the different regions. It seems to this was a little bit of a surprise that non-essential workers are a little bit more hesitant, which, it's actually a good thing when the essential workers are not hesitant, because they're the ones at the greatest risk for getting it. Although you want to see less hesitancy throughout. In Utah, the difficulty seeing a provider. Before the pandemic, you can see that it wasn't very difficult to see their provider, and then those numbers kind of go up during the pandemic, and the most common reason people have cited, for the most part, for having a problem seeing their provider was the conversion to telehealth, to telemedicine, which is a problematic thing because pretty much in all the forums that I go to with medical practice and delivery, people are touting telemedicine as the go-to, but you can see it will leave a community that's already disproportionately impacted even farther behind, if that's what, if that's the plan. These are the isolation sort of data.
Mhm.
This is early on. This was in April 2021 that we did the survey. So I'm pretty sure these numbers have changed significantly. Um, Same as some of the other behaviors. Although, it was a good sign that people were taking it seriously, and so that does give you hope that they'd be amenable to healthier behaviors. With food security, it wasn't too bad. It seemed like, oh, sorry, they did. There was some hesitant. There was no hesitancy based on, or a predominance of hesitancy based on food security. That's one of the other things that's sort of a surrogate for income. And we didn't quite see that play out as much um, with the hesitancy. And then these are the zip code breakdowns um, of the respondents, which I don't know what to make of it since I'm not from Utah.
I didn't see many from down here in Utah County, but I think that was
Yeah.
mostly Salt Lake County. Yeah.
I think so. I would agree. I think wherever Fahina is at, that's where most of the respondents came from.
Yeah.
And so, yeah, that's basically it in a nutshell. I don't know if it's playing out pretty much like that. Is Fahina on? Is she?
I don't think so.
No,
We couldn't get. She got disconnected and
she got
couldn't get back on.
disconnected. I know you can only have.
She was
as long as-
driving, so she probably got disconnected. I was somewhere along the line.
She's on one bar.
Yeah.
It is good to see us gathering our own data and having Pacific Islander doctors like this and forums like this leading the discussion about data that we gather ourselves about ourselves. Do you see those, and this is for both of you, do you see those trends with marginalized communities and populations going to get their own data? Do you think that that is something that we will hold on to and expand coming out of COVID-19? Or do you kind of see this as a need today and then maybe gone tomorrow?
It can be either, right? Like, without advocacy, people, the tendency is to revert back to the easiest way, which is to forget us. Yeah. And so, it's a constant struggle for us to remind, healthcare systems, agencies, public health offices, that we exist and our plight has been disproportionate. And so unless we have to constantly be in their ear to say how helpful that type of data collection is, because prior to that, we had very little, our data is very scattered, and the health equity around data long preceded the health inequity we experienced with COVID, right? I actually think that was the foundation that COVID needed to do the damage it did in our communities, right? And so my hope is that going forward, using the data that we talked about, also, Naupo is already involved in community-based data collection past this survey. They've already done the second wave with children and the hesitancy around receiving vaccines in Pacific communities around children. And so, I don't even have the capacity to speak for their data, but I think they're probably up and ready to start presenting, their stuff as well. And that comes from the backs of these community-based organizations.
Dr. Al, we always talk about, Neki and I are always talking about Utah and how, like in Salt Lake City, the percentage of Pacific Islanders to the population is extremely high for a city in the contiguous 48, right? So it's such a big piece of the population. In your experience in the medical field, do you see and it may be because you've been there and you've been in Hawaii, so you may not have seen, other models. But do you see that helping the Pacific Islander people, the community, having a bigger percentage of the population and maybe possibly having a bigger voice?
Yeah, where I practiced in California for my residency for 4 years, where I was, there was not a big, Pacific Islander community. And coming back here, the latest, I saw we have 38,000 Native Hawaiian and Pacific Islanders, and it's, West Valley City and Salt Lake have the highest per capita, according to the data that's on our utahcounty.gov, in the country. So there's a lot of Pacific Islanders there, and the Utah Pacific Islander Health Coalition meets very regularly, and they've got a lot of community health workers that go out and do education. They put on events. They put on vaccination events. They are spearheading this initiative to go and give vaccines to people at their homes. Like, I am grateful for the advocacy that they've done, and they've put the numbers together. Pacific Islanders are more than 2 times as likely to die. They're more than 2 times as likely to be hospitalized. So, we can't have survived, those epidemics in our islands,
right?
to die from this now. You know what I mean? Like, one of my good friends is, we went to school together. He's Samoan, and he's a lawyer. And so he's educated, and he also experienced, like, above his education, he experienced the fact that his family is small. And you don't see that very often in Samoan families. So he talked about how his grandfather and his grandfather's brother were the sole survivors of the 1918 influenza pandemic in their family. There are 13 members of that family, and only 2 survived. He said, that's enough for me to go and get this vaccine. So that was just, to me, so impactful. And like, being part of the LDS community, I have the opportunity to easily, look through my family history, and they built this timeline of my great grandfather's life. He had 20 children, but like 12 survived. And I think if any of us look at our family history, you can see the impact that, there are several factors involved in that, but vaccines have a lot to do with that.
Right.
And I think if we can just understand that, and, understand that, like, when you look at the Hawaiian population that was devastated, I think they estimated there were about 1 million there when they began to be colonized, and it went down by 70% within 70 to 90%, I believe, in a 70-year period. And I'm like, hey, my ancestors survived that.
Yeah.
We need to keep surviving, survive diabetes, survive COVID, survive everything, because we didn't make it that far just to die from something that we can prevent.
Exactly. That there's a vaccine that can help you not die.
And honor our ancestors, like, they would have jumped at the chance to have something like this. And I feel like, we had that forewarning. You see what happened in Samoa. Like, I wanted to leave so bad and go help those kids.
The measles.
Measles. Like, I didn't even think that could happen in this lifetime.
This day and time, right?
So many people die in one small place, and I'm like, we had that. We saw what happened, and we can't not learn from that.
That's a great point. We can learn from our history, so we don't repeat it.
We don't repeat it. And you're right. To survive what happened in 1918, and for your dad and his family to come all this way to have anyone pass away from COVID-19 when there's a vaccine to prevent it. Why wouldn't you? Why wouldn't you is the question. Okay, you got me all teary-eyed, Doc.
I can imagine that that Pacific Islanders were very far and few between in Loma Linda, where you were in Southern California.
There was a Samoan that was a respiratory therapist in the NICU. She saw my name up on the board, and she's like, and we saw each other, we're like,
We had who was it we had on our show that they shared their story about having COVID, and I think he was Samoan, but there was a Tongan nurse in the hospital and saw his name and came to him and
made it a point to check on him regularly. It's I can't remember when, but it's in California, you can't have anyone at the time, at the peak of COVID, you couldn't have anyone in the hospital. And so I guess you seen his name and recognized that he was PI and would check on him regularly because, so.
Yeah, she was giving him advice, and it was just one of those touching moments where, no, I don't know her from anybody, and she doesn't know me from anybody, but recognize it's another Pacific Islander, and went out of her way to help his journey.
Actually, I know at least 3 ICU nurses who are Tongan. One of them I met in California at Moreno Valley in the Riverside County Regional Medical Center. Yeah, she moved over to the Bay, I think, but it was nice, like seeing a Tongan ICU nurse.
Yeah, that's awesome.
I did actually. There are Pacific Islanders there. I just didn't see them too often, but every once in a while they'd come into the hospital or at my clinic in Moreno Valley. I had some Pacific Islander patients, my favorite.
Yeah. Yeah.
Someone's complaining that we're not answering her question in the chat.
Oh.
I thought that might come up.
Okay, so Miss Rhoda, she says, "Hello, family. Are you guys also tracking those who are getting the booster shot? Have you guys noticed that is hard for our community to get the booster shot now, like how it was to get them vaccinated? Are we finding that?"
So the Utah Pacific Islander Health Coalition is tracking that, and that's why they're making the effort to go and give the booster at the homes of people. So I think there's just a lot of confusion as to who's supposed to get the booster and where am I supposed to get this and should I get this, and so. Because I even have people I'm just going to go get my antibodies tested, and if it's positive, then I'm not going to get my booster. We're like, no, that's not how it works. We'll explain how it works if you want to know, huh? What were you saying?
I mean, I think it's open now for everybody. So
it is.
If you've gotten it over 6 months ago, then you should get the booster. But it's very, I don't know. I love it when. I love that people are talking about science, but it's very interesting that all of a sudden, you're able to decipher medical concepts when last year you didn't even know what your A1C was, and so it's a very go get your booster basically, is kind of the party line right now, I'm glad they're making more efforts to get that out. As far as getting it, I don't know if anyone's had that much trouble. It was harder to get it when it first came out.
Yeah.
Now, you can go to CVS, you can go to all these other commercial pharmacies to get it. There's a lot of CBOs out there pushing their vaccination clinics. So, it's a lot more. It's easier to get it, I think, than it was before.
It is. I just find that people are confused about because they'll come out and say something and then it changes, but not everybody has access to the information the way that we do, and so that's why the Pacific Islander Health Coalition is really important, because they help to disseminate that in ways that will get to people. So yeah, I agree. I just have heard even, and I'm not even talking about Pacific Islanders. I was in line to pick up a medication for my daughter at the pharmacy, and this man, and this is back when they had said get the booster, but they're like, oh, we're going to limit it to this, and this older man was just confused. He's like, I thought I was supposed to get it now, and so I went, and the pharmacist had to come and talk to him, and I'm like, hey, I'm a physician. He's right. He's not, he's telling you the truth. So just wait and, keep checking back on the, on the website, they'll tell you when it's time for you to go do it. But I think it has been confusing for people.
Well, that's actually, we can make a note of that. Maybe we'll work with Naopo and have a show just about boosters and educate everybody about, the details of it. Because it does seem to, and I think one of the big problems is there's disinformation. So for every information campaign that's out there, there's 80 million comment sections and memes and all those kind of things that are disinformation that are out there as well, like the antibodies test. somewhere somebody got the idea that no, that'll just do it instead of, you know what I mean? Like, so there's so much disinformation out there. Maybe we can get some good stuff out there.
Yeah,
Like
no,
the
my
hold
uncle that
on
way.
to. Oh, go ahead.
Oh no, go ahead.
Oh, no, I was just gonna say, like, well, people like hold on to like, well, they said those masks weren't going to work. I'm like, well, we have more information now. I didn't think they were going to work either, those cloth masks, but now we know they do because they've done these great studies and we know they do work. So things have changed. So yes, they were kind of, worried about that in the beginning, but now we have more information, and that the same goes for everything that we're learning. We know way more than we did a year and a half ago. So yeah, things are changing, but that doesn't mean that they were lying before. We just were going off of what we had.
Right.
Oh yeah. Yeah. Yeah.
That's such a good point.
Yeah. I mean, the misinformation is a tough one. Like it's coming rapid, and I think social media has done its job in promoting disinformation or misinformation because the algorithms, right? Like once they get on the algorithm, that's all they see. All they see is anything that's
so it must be true, right? If it's on
True.
Facebook, it must be true.
Yeah, like I don't know how many times people have like, why don't they use ivermectin? Because it doesn't work. Like we have studies. They're like, the best is when they send me like what they think is a study or a publication, and I'm like, this is a study announcement. And it's closed. And if you look at why it's closed, it's because it didn't work.
Right.
Like
well,
why?
It's so crazy that there's you're right. The social media turns your feed into an echo chamber. So if you believe a certain something about, you have an opinion about something and you're opinionated about it, that's what you're going to get in your news feed. You're going to get more of the same opinion.
Oh, absolutely. And so Dr. Au and I, so shout out to the pediatricians because there's not that many of us, we both trained in med peds. And so there's this whole slew of new kids and the vaccine and COVID, although like early surveys show that pediatricians aren't really sort of what they're using to make their decisions about whether to give their kid the vaccines. It's more coming from peers. But it's good to know that there's some of us in that space. I think I can count on my hand how many Pacific Island pediatricians we have, like.
You don't even need a whole hand.
Right? Yeah, and so it's good to sort of talk to them. I think that's the other thing too, is because there's not a lot of Pacific Islander pediatricians, you don't get, you know what I mean? Like that's why it's not a big that's why we're not a reference yet, right? People don't think about asking a Pacific Islander pediatrician kids about, their question about their kids because they're not used to it. And so it's important for us to be present in that space so that we can help dispel some of the misinformation. But, even when you go past COVID, there's a whole host of preventative things that need to occur in childhood, that there's a lot of healthier behaviors that can be garnered by speaking to medical professionals. And so, yeah, that's just my little commercial for
how much do we owe you for that?
right. Yeah. And Dr. Al just joined Happy as well, because it's important for us to constantly show Pacific Islanders in that space.
Yeah. Oh, definitely.
Right. There's kids out there that don't know that profession is a possibility. I was lucky. My pediatrician was Samoan at Kawehi Valley, like the only one on the island. And I just haven't. And so for me, in my head, it was never like it wasn't a far-fetched thing. Like I already seen somebody else could do it. And so, and then, most of it's starting to change, but most of the medical students when I was training were male. And so Dr. Au's presence in this space is huge.
It's
right?
huge.
Yeah, we're starting to see the numbers even out a little bit when it comes to medical students, Pacific Islander medical students, but we're nowhere near where we need to be when it comes to prompting medical careers for young Pacific women.
Yeah, I think the modeling is so important. Like Dr. Ao had talked about earlier, that's what was visible. That's what I see, and that's what I see as possible. Then it becomes, like you said, well, why be? I want to be a nurse, and then, well, you could be a doctor. Why don't you be a doctor from early on? From, I think she talked about age 5.
Yeah.
So very important to get those role models and that those images out there of us doing things that some kids may not know that we do. One of the things we did want to carve out some time for was the Omicron variant. Last I saw, it was in 17 states, including Utah. A lot of questions, a lot of question marks out there about that. So I wanted to maybe just throw that out to both of you and have you talk a little bit about what you know about the Omicron variant.
We have more questions than answers.
Yeah.
I that. I don't know what Dr. Ao's experience is, but here at my institution, because I'm at a cancer hospital, and we don't know how virulent this strain is to the vaccine. We don't really know if it's the transmission is easier with Omicron. We just don't know a lot about it. The Delta is still the major variant that's being transmitted in the U.S. Mostly the continental U.S. Although Omicron cases have been identified in Hawaii. And so, it's the game plan hasn't changed for the most part. Get vaccinated, and take precautions. We haven't seen anything on Omicron lately that makes us think that we should do anything different in regards to that.
That makes sense.
Right.
Dr. Ao?
Our infectious disease specialist for the main healthcare system here in Utah said the same thing. She's like, Delta is the one that we are dealing with the most right now. So deal with that and worry about the other one.
Right.
We don't have enough, like he said, we don't have enough
Yeah.
information about it yet.
Right.
Yeah.
But that calls into sort of our responsibility globally. When you're dealing with pandemics, you can't write off countries. If we're going to, because of the way the world works these days, the plan now has to be for the world, and if they don't have an adequate supply of vaccines or adequate vaccines, we're just going to continuously see these strains pop up, and so, I think we need to concentrate on what we need to do with Delta to get rid of Omicron.
That makes sense that the media, is going to go to the new shiny, cool, new variant. Well, we're still dealing with the true problem at this point, what we know to be the biggest problem and the one we have a solution for. But yeah, the more you talked about that, the more I just think of how media works, and they're going to shine a light on whatever the next new flashy thing is. So appreciate your time with that, because we don't have a lot of information on that, but we appreciate that.
Yeah.
But you also have to know that South Africa is a small country as well. Not small, but it's smaller, and
Right.
So testing variants are somewhat easier to do by the CDC when you have sort of a smaller country, and it's really hard to say where the spread is, because initially what people wanted to do was travel ban South Africa, but then when people started testing it across the world, the variant was already it was already all over the place, and so one has to be very careful about the introduction of variants. And you're right. I think a little bit of it is clickbait, in that a new variant will cause people to tune in or something. But the nature of these types of pandemics, you have to be very careful before you just sort of shout out like there's something new, before knowing anything about it.
Right.
Right.
Makes sense.
Makes perfect
Glad
sense.
we had 2 doctors on to talk about it.
Yes, awesome.
Because if you want advice about things, if you want, and I think it was Dr. Samoa that said this, if I want to get my car fixed, I'm going to go talk to a mechanic. I'm not going to talk to, I don't know, somebody who doesn't work on cars. And if I want to get health information, best place to get it is from a couple doctors.
That's right. So awesome. Our hour is up. It went quickly, but we are so grateful for the great information that we received. Dr. Ao, is there anything last minute thing you want to get out before we close out and let you get back to your family?
No, just thanks for having me. I didn't really know what to expect with this, so I appreciate how warm and kind you've all been, and just everybody take care of your families. Be safe. Yeah.
Thank you so much for your
Doctor.
time.
Thank you.
Thank you so much, Dr. Samoa. Thank you. I'm sure we're going to have you on some more because we just are last minute that way. Fahina. So, bad connection. We're so sorry. We missed out on all the great stuff that they're doing there at Fahina NTAS. So we will hopefully get her back on another time. But Dr. Ao and Dr. Samoa, thank you so much for your time. This is Koviki Talk. We will see you soon. We're going to take a holiday break and be back in the new year. So thank you so much for your time. We appreciate it. Come back and we'll see you soon.
Thank you.
Thank you.